Today I'm with Dr. Eric Prystowsky, who is the Director of Arrhythmia Services at St. Vincent's Hospital in Indiana. Dr. Prystowsky is this year's recipient of HRS's Pioneer Award, and he's been a mentor to many of us here at the meeting. Dr. Prystowsky, welcome to the show.
Thank you so much, Kevin.
So, what do you think the future of EP looks like?
Well, I think it looks very bright. First of all, we've come a long way. I did some thinking about that when I was preparing my acceptance speech, like where I started when we had a couple drugs and a VVI pacemaker, and to where we are now. And I think the future is incredibly bright. I'm enjoying watching non-invasive approach, but I don't mean non-invasive like Holters. I mean like the kind of way you can map a heart non-invasively and then treat it non-invasively. I think that's the future. I hope the younger generation of electrophysiologists can answer the things that we've not been able to answer, the big question of why something occurs, not just how to treat it and what it is. And I'm very hopeful. There's a lot of bright young electrophysiologists out there, and I want them to answer it before I get the problem.
Well, let me ask you, why do you think HRS is so important to be a member, and also why is the meeting, the annual scientific session, so important to all of us who practice EP?
That's a great question. You know, so much of learning now seems to have gone online. And you know that. I mean, we all do online teaching, but eyeball to eyeball is just different. And in fact, for all my years of coming to HRS, I would say I've learned much more in the hallway than from any podium. Now, it might be the podium speaker, a buddy of mine, some new investigator that I've not met before, who I grab afterwards to sit down and say, tell me a little bit more about it. But that's where you really get the connections. And those connections are important. You know, we don't live in a world by ourselves. So HRS is the meeting place. HRS is where it all happens. People come from around the world. It's the top meeting. I know I'll be in trouble with all my international colleagues, but let's be honest, this was the first. And I think it's still sort of the granddaddy of the heart rhythm meetings. And to be a member, to participate, means to be a part of the whole. So I think it's vitally important to be a member and participate.
You know, you've mentored so many electrophysiologists throughout your career, including me. What advice do you have for young EPs today?
That's a wonderful question. I think the greatest problem now is the distractions. Extraction is also a problem, but that's not what I want to talk about. The din around us, the noise, the RVU counts, the government this and that. Remember why you went into this wonderful field. I mean, I went in to find cures and treat patients with heart rhythm problems. It's been an extraordinarily rewarding field for me. Just forget the noise and just sort of focus on why you became an electrophysiologist. Think of your own career. It doesn't matter if you veer off in places. You've done that beautifully. I've been sort of a guy who stayed on the tracks, but there are a lot of my colleagues who've decided to go in administration or other things, but they still participate and they're still adding to the main. So what you want to do if you're a young and up and comer is remember why you went into this field, and don't get distracted by some RVU count that someone's thrown on your head. You were an electrophysiologist for a reason. You wanted to help people with heart rhythms, and just go do it.
That's great. Thank you so much for joining us today, Dr. Prystowsky. It's always a privilege to speak with you, and I'm looking forward to learning from you throughout my career.
Thanks, Kevin.
Nice to see you.
You too.